Hi, good night, guys. Tonight's lecture will be on dental implants. And excuse my voice in advance. I'm having a bit of chronic sinusitis, acute on chronic sinusitis. Sorry. So, what's the purpose of an implant, or what is an implant? An implant is a medical device made from probably most times more than one biomaterials. It's placed in the alveolar bone to facilitate reconstruction of missing teeth. So, what are the requirements of an implant? It must have certain properties. So, for example, I'm going to give you some definitions right now. So, elastic modulus, what is that? That is the number or a figure that measures an object or substance ability to resist being deformed elastically. And if you remember, elastically is when you want to stretch a material, stretch it outwards. So there's an outward or an expansile force as opposed to compressive forces, which represents a force that is required to make an object smaller in size. So an implant must have a good value for its elastic modulus. It must be stiff, and stiffness refers here to the resistance of a material to break under force. So, for instance, the material cannot bend easily when it's placed within the alveolar bone. Okay? Must also have good tensile strength. So, in other words, when you want to pull something to the point that it's breaking, the material must not break. Put it that way. It must be able to form like fine wire. So that's tensile strength. Ductility is when a solid material stretches under tensile strength, elongated. So if it's ductile, the material may be stretched into a wire. So once again, it refers to the elastic expansile forces. So for instance, if you take one side of a metal and try to stretch it with another person, that refers to ductility. Malleability, this is when compressive forces can be applied to material. Remember, I was saying that compressive forces are forces that are required to actually make a material smaller in size, and it deforms or i.e. flattens that material by hammering. So that refers to malleability. So if I'm able to hammer material into a flattened sheet, that is malleability. Okay? Sorry about the sniffling. Another property that a material that is used for implants should have is that it should be biocompatible. Also, it should become osseointegrated, meaning that it is able to form new bone and become incorporated into the surrounding bone. So it must be resistant. It also must be resistant to occlusal and mechanical loads in the end, in the oral cavity itself. So as you know, implants can be placed anywhere in the mouth. It can be placed anywhere along the alveolar bone. Certain parts of the mouth actually have greater occlusal forces than other parts. For instance, the anterior teeth don't have as much occlusal pressure as the posterior teeth, which have a larger surface area. Therefore, more pressure is applied per surface area posteriorly. So we're also going to continue with some more definitions. So osseointegration is a direct structural and functional connection between a living bone and the surface of a load-bearing artificial implant. Also, we must mention that implanted material itself can be a wide variety of materials such as titanium, stainless steel. You can actually have plastics such as polyethylene. You can have high fiber or high strength plastics such as polyethylene or PFTE, polyfluorotetraethylene, which is used, as you know, in grafts, for instance, in the saphenous vein. So what can happen if you implant a material into a person's body? Well, as you know, it's a foreign material entering into a person's body. So if you implant material into a person's gum, you can have sterile abscess formation. You can also have the formation of connective tissue layer around the prosthesis, as well as you can have viable tissue in close proximity to the inert material, and there can also be chemical bonding or formation of bone around the actual implant itself. Now, some of these are favorable, some of these are not favorable. So, for instance, bone formation around the implant is not necessarily a bad thing because it helps to keep the implant lodged in place, and therefore it prevents or reduces the likelihood of an implant failing. Now, if you remember that, well, not if you remember, sorry, if you think about it, an implant is like putting a piece of metal into a cement pot, or a pot with about a liter of cement. When you put the implant into the pot, you're hoping that the cement hardens enough to prevent that piece of metal from being extracted or pulled out of the pot. Same concept here. So we're actually hoping that the implant doesn't affect the bone and cause any breakdown of the surrounding bone. So you're hoping that the bone can actually form around the implant, creating a very good base. So how are implants placed? So they're usually they can be 2 steps or 1 step. So we're going to talk about the 2-step method, which is first, you have to prep the patient. Usually give them antibiotics and painkiller, then a local anesthetic is given. Sedation, which can be given via the intravenous or oral route, can also be used. An incision is given, which at the area that you want to put the implant, and the gum itself is cut to expose the bone. A hole is drilled and the implant placed. So as most persons who have done like any form of training in terms of surgery, you know that once you place an implant of any sort, especially on bone, you need to do a post-operative x-ray to see if it's placed correctly. So an x-ray is taken of the area to check the position, and the gum is then stitched. And this procedure usually takes about an hour or less. Post-operatively, you must encourage the patient to have good oral hygiene, which means no smoking, no sucking on the straw. There must be no spitting, which is kind of like the same precautions, for instance, if you do an extraction where you try to not get them to spit, because that can dislodge the clot in the area. Patient must also be on a soft diet, because you don't want any trauma in the area. And for a few days, no cleaning of the implant area. So for about 7 to 10 days. Now, like I mentioned before, one of the things we want to ensure is that the implant bonds with the bone. Now, the upper and lower jaw actually takes a little bit long. They have different values for when they are able to bond with the implant. The bone in those areas are able to bond with the implant. So the lower jaw bonds usually take about 3 to 4 months to occur around the implant, while in the upper jaw, bonds usually take about 5 to 6 months. So remember, the lower jaw is actually able to form a bond quicker with the implant than the upper jaw, which usually takes 5 to 6 months. So that represents the time in which you bring the patient back to do the second procedure. So the second procedure, local anesthetic is given, the gum is cut, and the protective screw from the actual implant is removed from the implant and replaced with a collar or material, which is a collar or metal heading cap. Okay, so this healing cap allows the gum to heal correctly around the implant for about 2 to 3 weeks after the second surgery. So the 1 step, the implant is placed in the jaw and remains exposed in the mouth. So therefore, there's no second surgery needed for the 1 step. But this step has 2 steps as mentioned. The first step, then the 3 to 4 months, depending on if it's a lower jaw, or 5 to 6 months, depending on if it's an upper jaw. You bring them back, you do the LA, cut the gum, and remove the protective screw from the implant and replace on the collar or metal head healing cap. And therefore, the healing cap allows the gum to heal correctly around the implant, as mentioned before. And this takes 2 to 3 weeks after the second surgery. So 2 to 3 weeks after the second surgery now, a crown itself is placed, or a bridge or a denture made at the area, in wherever the procedure is being carried out. Okay? So as with any procedure, there are complications: bleeding, infection, damage to surrounding structures, nerves, and sinuses. So this must be performed by a person with great care. There is implant failure, but however, it must be mentioned that there are success rates of about 90%. So what would indicate that an implant is failing? Well, as with all implants, whether it be orthopedics or oral and maxillofacial surgery or dentistry in general, implantology, loosening after the first stage of the surgery, which occurs about 4 to 6 months afterwards, will tell you that there's something going on with the implant and that it's failing. An implant failure secondary to failure to integrate with the bone post the first stage of the surgery can, as I mentioned, is what we have to look out for. What causes this? So it can be surgical trauma, infection of the implant, decreased blood flow secondary to smoking. As you know, smoking causes constriction of the blood vessels in the area, in the alveolar. And as you know, the alveolar area is a very vascular area. You want as much blood flow going to this area as possible, which promotes healing. Less blood flow means more likelihood of ischemia, okay? If there's not a lot of healthy bone in the area, this can also cause a failure of the implant. Another thing too is that in a small percentage of patients actually have titanium allergies. Now, that